Well, without further ado, we'll go over and I'll start the question, and you all have it here. I'm going to start with Judy Halstead, and we're going to ask all three panelists, with Judy starting, what are the criteria and principles that all health professions have for core competencies?
So how can including core competency concepts and accreditation standards be linked to improved quality in education and healthcare systems? So as I began to think about that question, and I do have brief little notes here to stay within my 2 minutes, so hopefully I won't hear the gong, I really focused on the how. How can core competency concepts be linked to improve quality? Well, that takes me back to what has to happen in order for accreditation to be in position, or accreditation standards to actually be in a position to include core competency concepts. So I think, first of all, I thought there has to be the collaboration, and we spent the last day and a half actually talking about this. Collaboration across the disciplines has to occur to identify what those core competencies would be. And in order to have that piece occurs, that means you have to have the linkage between education and practice, because you can't identify what those core competencies should be without the two entities coming together synergistically to identify those. And then taking some of the feedback that we heard yesterday from Susan, and then what Malcolm actually also re-emphasized this morning, if we really want to improve quality, we actually have to know what we're talking about. So what do we mean by improved quality? How do we identify that? What are some evaluation strategies to measure that? So you kind of have to know where you're going. And so as I look at all of this, the value lies in the process of getting to where those core competencies can be identified and then included in our accreditation standards. So I think that is where I will start the responses, and I will stop there before my 2 minutes. Thank you.